Before the surgery, the main issue I had with my knee was that I couldn't do a full extension. So it affected my ability to get up from a chair. When I walked, I was walking with my knees sort of bent all the time, which then made the sides of my leg hurt, which made my calf hurt, my ankle. So that was the problem on that one, was that I didn't have the full extension. And I will say that really, within a couple days after surgery, I had full extension. My physical therapists were the ones that were telling me, a couple had seen it, a couple had not. And they were just, oh, okay, that spares the quad, the incision site is smaller, you're able to be up and about, and we could do all the quad strengthening exercises right away. And I really think that helped. Oh, I most assuredly would. I mean, not only is Dr. Bonenberger obviously a fabulous surgeon, but I really think his bedside manner is so supportive. Once you find yourself missing out, do it. Do it. Don't miss out for years. Stand up for yourself.